All right, hi guys. So bear with me. I'm sick and don't feel well, and I sound horrible. But I'm going to be doing the oral prompt for setting up the birth tray and what has to be sterile versus disinfected, and so on. So my preceptor does it a little bit differently. We actually have three trays that we set up. One of them is specifically just like the tray with the warming pad on it, with newborn blankets and towels, and a shoulder roll on it, and that's all that is on that tray. Sometimes we'll put fluids on there if they've been a little bit cold, so we keep them up to like room temp and whatnot, but that's kind of its own tray. None of that is sterile. It's all just disinfected. And then that's where we put the baby if we have to do some sort of resuscitation. And then moving on to it, we have the newborn tray that we set up, and that one essentially has like a newborn stethoscope on it, the bulb syringe. Sometimes we even have a bulb syringe on the delivery tray. Also, it just depends kind of on how we're feeling that day. Then we have an LMA, we have a DLE, we have a pulse ox for a newborn, we have the newborn stethoscope. Um, I don't want to say that that's everything. Sometimes we even pull out a glucometer for a baby if we have to check their blood sugar and or sweet cheeks, which is like a little thing you put in their cheeks if they are low on blood sugar. It just depends kind of on if we're concerned or not that might be an issue with this baby as they're coming out. And so that's the newborn tray. And then as you go over to the actual birth tray, this is kind of where some of the things overlap, some don't. But in our practice, we basically have an entire meds box that we already have um, a 5 cc syringe and needle with it pulled up for Pitocin, a 10 IU of Pitocin. Sometimes we will prep a LR bag as well with Pitocin in it, depending on how high risk they are for hemorrhaging. Um, Other times, if we don't use that bag, then we end up just wasting our Pitocin, but it was fine. So we actually pull up the Pitocin with a different needle than what is the one that we're actually going to be poking the person with, just out of the fact that we want to keep it brand new and sterile, and also we want to not dull the needle. So when you actually do pull up the Pitocin, it kind of dulls the needle, and it can make it more blunt for going into the person. So we switch needles out for when we actually draw it up to when we poke the person, and both of those should be sterile. And then the Pitocin itself is something that we have out in our meds box. We also, in that med box, have our Methogen, our Biso, and a couple of other things. And all of it's just in one little, like, it's like a little box that just has everything in it. It's really convenient. And then you also have to have sterile 4x4 gauze and these, like, little tiny gauze that you'd use if like, you were drawing blood and stuff. Um, so those actually come in the birth kit for us that we order from them and have people order. And so we just pull it straight from their birth kit. And there's a couple of other things that also come from their birth kit that we put right onto our trays instead of resourcing those ourselves. And umbilical clamp that you want to have sterile. Basically, it's in a closed package, and then you just open it and put it right on, and then just stay sterile with her gloves. Um, Umbilical clamp and umbilical scissors. Sorry, I said clamp. So umbilical scissors. We sterilize those in a package with sterile gauze. So like the gauze and scissors come together in one package. So they pull those out. Um, you want to have episiotomy scissors. My preceptor tends to only want to do that with primes because most of the time you don't really need it with someone who's not a prime. And even then, she doesn't tend to do it very often. We just pull it out, especially for primes. Um, and then we have our hemostat or Kelly clamps. She wants at least one pair because every now and then we have like trailing membranes or just something that she needs to grab, or if like a vessel pops, that's something that we need, and those are sterile. Um, Sorry, my kiddos are just having a rough day. Uh, and then we also have a catheter out in case we need to catheterize them for postpartum. If they can't get them to urinate, or if it just happens to be something that comes up and we need to have that out. Which comes with that is iodine packets that are sterile, alcohol wipes that are sterile, and lube packets that are sterile. Um, all Some of those are all for like examinations. Um, some of those are for just like wiping things down before you give an injection, or cleaning like the saline flushes, which is another thing we have to have on there. Some saline flushes for like IV tubing and whatnot. Um, so you basically have to have all the different wipes and things. The iodine's only for the catheterizing. We don't use it for anything else. And then we have a vitals bowl. So it's literally like an entire bowl that we just put all of our main vitals things in. That those are not sterile; those are just disinfected, and that's our blood pressure cuff, our stethoscope, our thermometer, our pulse ox for the mom, and our there's one more thing. Oh, the Doppler and gel. Ha! I was like, there's something else. Um, And then as you keep moving down the list, you start getting to like the IV supplies. So you have tape on the board all the time. But as far as our IV supplies, we actually usually have a packet that we put together, and it's pre-wrapped like in the in the tourniquet. It's like wrapped around that, and so that way we can just grab the pack and go do what we need to do really quickly. Um, so that basically would include the tourniquet, like I said. That would include the IV tubing, the IV catheter, the IV extension. That would include gauze. That would include a band aid. That would include the Coban for wrapping it around after. We'd have LR fluids pulled out. Um, there'd be the small gauze, like I talked about. Usually we put a couple in that one extra. Um, and then I want to say that that is everything that we have in our little packet for doing an IV. And then you have to have the pull out and raised up and like prepared for if you're going to use it or not. And then as you keep going, you basically want to have gloves out. We have a box of regular gloves, and then we have our actual sterile gloves that come in her little packages and stuff that we pull out for her. Sometimes there's the 2 packs, otherwise there's the singles that she'll use mediums, and so we know like if that's small, we just toss it out. We don't put it on the board. Sterile gloves can be used for examinations after. Sterile gloves can be used for vaginal exams. Regular gloves are more used for like touching the patient and touching things to protect yourself where it may be touching blood and other fluids and things coming out. And then um, the bag mask is usually on the newborn tray, but it is still something that you want to have out for delivery. And then we also have the placenta bowl, which is usually just a bowl from some of a person's house. We have a gauze that we put it in also. Not gauze, a Chucks pad. There we go. So you also want to have Chucks pads out and clean towels and garbage bags because we have one garbage bag for garbage and one for laundry, and that's how those stay separate. And then we just put the laundry one in the washer on our way out and take the garbage out. And I believe that that is everything. Thank you for bearing with my horrible sickness today.